Here are the 4 most common mistakes that I see patients making when choosing their facial plastic surgeon. Mistake number 1, choosing your surgeon based on price. I understand everybody is working on a budget, but if there's one thing in life that you don't want to compromise on, it's your face. Everybody out there can see your face, and if you're chasing a deal, you're likely going to end up with results that you're not happy about. A lower price, in my mind, triggers a couple things. Maybe the surgeon doesn't have much experience. Maybe they're not board certified. Maybe they don't do much of the specific procedure like a facelift, and they're trying to get more experience doing it this way. This may also mean that they don't have much follow-up care with you. They may not have much support for you from their nurse, from their coordinator, while you're healing or leading up to your surgery. Chasing a facelift surgery for the price is not an ideal option in my mind. A price reflects many things, most of which is the value of getting a really high-end natural result, a long-lasting result. Having a great experience from the consultation to your surgery to all your follow-ups. Having support from the office and the staff throughout your surgical experience. These are all things that add to the value and therefore the price of your facelift and neck lift. I tell patients, instead of looking at the price, look at the artistry that the surgeon brings to the table. Look at the before and after results. See how you connect with the surgeon. See how you connect with the coordinator and the nurse. These things are much more valuable than the price of the surgery. Think of this as a long-term investment. My patients come back to me after their surgery and their follow-up and they say, Dr. Sanan, this is worth every penny. This was the best investment I made. I feel more confident than I ever have. I recognize a younger version of myself. I feel beautiful. These things have no value. They're invaluable in the way that patients smile, the way they radiate when they come in for their follow-up. So I encourage you to look beyond the price tag. Mistake number 2 that patients make when looking for a facelift surgeon. They're overlooking their credentials and their experience. Facial plastic surgery is a very, very niche field. It requires many hours and many years of training in head and neck surgery and in facial plastic surgery to become double board certified. It's important to ask your surgeon about their experience and their background and training. Some surgeons have focused their career solely on reconstructive procedures. They don't really understand the nuances of aesthetic surgery. Some surgeons have been trained from facelifts to breast surgery to tummy tucks. There's no way they can be a true expert in facelift surgery. So it's important to look up your surgeon's credentials, to ask them about their background, their training, and then their experience with facial plastic surgery. One of the things you're going to do when you look up a surgeon is see if they're double board certified. What does it mean if someone's double board certified? For facial plastic surgery, that means you've completed a residency in head and neck surgery, so there's board certification for that, and then you've done a fellowship in facial plastic surgery, so there's a board certification for that. In order to become board certified, you have to complete both those residency and fellowship. In addition to that, you have to take many exams. You have to take a multiple choice exam, you have to take an oral exam. Lastly, you have to submit hundreds of surgical cases that you've done independently to the boards. They review the surgery, they review the outcomes, and if they think that you've done things well, they give you board certification. Mistake number 3, not evaluating if your surgeon exclusively specializes in facelift surgery. Not all plastic surgeons feel facile or are well trained or well experienced in facelift surgery. Some surgeons will do breast surgery, they will do tummy tucks, and then they may dabble in facelifts. Inherently to this, they cannot be an expert in facelift surgery. An expert, in my opinion, is someone who solely focuses on aesthetic procedures of the face and neck. Therefore, you can be an expert facelift and neck lift surgeon. It's also important to talk to your surgeon about the preferred technique they use. The traditional techniques, which I've talked about in a previous YouTube video, in my opinion, have short-lasting results with poor scarring. Deep plane surgery is the gold standard, in my opinion, for facelift, neck lift, and overall facial rejuvenation. It's important to ask the surgeon about their preferred technique, to look at their before and afters, and somebody who really specializes and is an expert in facelift surgery will do mostly, if not all, face and neck lift rejuvenation operations. I specifically specialize and perform deep plane facelift and neck lift surgeries. I do not do any breast surgery. I do not do any body surgery. I truly expertise and focus solely on the face and neck regions. My approach to and philosophy to facelift surgeries is that it's bespoke. It should be customized to your specific face, to your specific neck. I study your photos. I look at your aging patterns. We talk about your goals to create a customized plan for you. Mistake number 4, not taking the time to feel a connection with your surgeon and your surgeon's team. I think it's very important during your consultation process, when you're talking to the surgeon, that you feel that they're listening to your goals, that they're resonating with what you're trying to achieve with surgery. Plastic surgery, and specifically facelift and neck lift surgery, is not a one-size-fits-all approach. It is a bespoke operation that requires years of artistry and a very, very discerning eye to give you the most natural and elegant result. I really value the time I spend with my patients. We have a very thorough consultation, and before we have the consultation, you talk to my patient coordinator. She makes you feel very comfortable. She listens to your concerns. She makes you feel heard. She then helps you create a plan and understand what we're going to be doing in the consultation. During the consultation with me, I look at your photos, I study your face, we examine you in person, and I talk to you about your goals. I really want to understand what you're trying to achieve and what you're trying to attain by doing a facial rejuvenation operation. In addition, I rely on my team heavily to create a very customized experience for my patients, and all my patients really value my team, from my surgical coordinator to my nurse to my medical assistant. It is a very, very comprehensive experience for my patients. We make sure that you feel heard, that you feel safe, that you feel that you're cared for. And there's nothing that really replaces that except for the time that we spend with the patient, the accessibility we give to the patients to make sure you have the best experience and best result possible. So in summary, what sets my practice apart is it's built around precision, artistry, and natural rejuvenation. From the moment you have your consultation with me to all your surgical follow-ups, the experience is centered around you. We want you to feel safe, we want you to feel cared for, and we want you to feel like you've had the most natural result and the most meaningful change while still looking like a younger version of yourself. If you're considering facial plastic surgery, take the time to research your surgeon, feel comfortable with the office, feel comfortable with their philosophy, and then don't make these mistakes that I just talked to you about in this YouTube video. Thank you for watching, and if you enjoyed this video, please like and subscribe, and stay tuned for more facial plastic surgery education.